let us see about the heat emergencies. There are mainly three heat emergencies are there. There are mainly three heat emergencies are there. The first one is heat exhaustion. Heat exhaustion is nothing but when we continuously exposed to sun rays or sun heat, we will get heat exhaustion. Heat exhaustions are manifested by water and electrolyte imbalance. If water we have drunk only half liter whole day or 1 liter whole day and we are continuously exposing to the sun rays, what happens? The fluid from our body gets exhausted because when we stay in the sun rays, the sweat produces from our body more, right? More sweat produces from our body and more water losses from our body because it is our body mechanism to act against the heat. Our body is acting what? When we stay in the sun rays continuously, our body is trying to cool down our body by producing the sweat, right? But what is happening when we produce more sweat? The ultimate response of here is like in our body, loss of the fluids, right? We are losing more fluids in the form of sweating. So what happens? Water imbalance. Along with the water, what is evaporating? Electrolytes. What are the electrolytes? Sodium, potassium, calcium, magnesium, chlorides. These are all going out of our body. What happens when water is not there in our body proper amount? When electrolytes are not there in our body proper amount, obviously we fall into the heat exhaustion. That causes nausea. Nausea is nothing but feeling of vomiting. Like after we have food, if we are sick, if we have food, what we feel like vomiting is almost coming, but we won't vomit it. That is called as nausea. Vomiting means expelling the gastric content outside. And profuse sweating. The symptom of exhaustion is profuse sweating. You will get like profused, the excessive sweating, and excessive thirstiness also present in your body. These are the few symptoms of the heat exhaustion. Heat exhaustion caused by water imbalance or fluid and electrolyte imbalance. Understood, right? Second one is heat cramps. The second one is heat cramps. Heat cramps are nothing but cramps. Cramps means pains. Cramps means pains. When you continuously expose it to the heat, the first thing causes the heat exhaustion or heat exhaustion. Heat exhaustion means fluids and electrolytes are going out of our body. When the electrolyte imbalance is there in our body, what it causes? It causes muscle contraction. Why? Because the electrolytes, the potassium and sodium, even chlorides, contributes the muscular movements. Do you know that if potassium is less in your body or in your blood, you may lose the function of your legs also, or you may lose the function of your hands. Why? If these electrolytes are not present in a proper amount, in a balanced amount, your muscles cannot work. Even heart also can stop working because these muscles are the vital things to function, the vital things to proper functioning of the muscles, either voluntary muscles or involuntary muscles. Understood? When these electrolytes are imbalancing in the heat exhaustion, that it causes the muscular contraction. When the muscles are contracted or spasm is present, can you able to move your hands properly? No. Can you able to move your legs properly? Normally? No. That is what exactly it is happening here. When we expose continuously to the heat, that is the reason continuous exposure to the heat is not good for the health. Either in the form of heat emergencies, even if you continuous exposure to the sun rays, what happens? There is a chances of getting skin cancer also, right? Why? The UV rays are more in the sun rays. So, these are all the symptoms of the heat cramps. What happens? The carpal spasm. What do you mean by carpal spasms? The carpal bones are present, metacarpals and metatarsals. So here the carpal bones are present here in your wrist. When the spasm means the contraction takes place in your wrist, you can't move your wrist so freely, right? That is the reason unable to move your hands and legs. And abrupt cramps. What do you mean by the word of abrupt? Sudden cramps. We were not knowing why all of suddenly I am getting pains. You may not aware that okay, because of I continuously exposed to the sun rays, I am getting pains, right? So abrupt cramps, the sudden onset of the pain takes place in your muscles. So these are the symptoms of heat cramps. What are they? Next one is heat stroke, the third one. The third of heat emergencies are the third one, heat stroke. Heat stroke is nothing but hyperpyrexia. What do you mean by hyperpyrexia? If the temperature, body's temperature increases more than the 1 degree Fahrenheit is called as hyperpyrexia. In that condition, what happens means multi-organ dysfunction. Multiple organs in our body like brain, respiratory system. Brain means central nervous system, muscular system, respiratory system, and kidneys fail to work. I already told you that if body temperature normal only, our internal body organs can function properly. If it is less also, our body organs cannot function. Less than the normal body temperature. Or if it is more than the normal body temperature also, our body organs cannot function properly. That is what it is happening. It's okay if the temperature below 104 degrees Celsius, the body organs can manage with the temperature, but not for a long time. But what is happening here? If the person continuously exposed to more than 104 degrees Celsius, 4 degree Fahrenheit, the organs started failure of function. The organs started failure of function because they cannot sustain in that excessive heat. They cannot function properly. So obviously that it causes the failure of the multiple organs. So in this condition, what are the signs and symptoms present in the heat stroke? So the clinical manifestations of the heat stroke are slow respiration. As I already told you that the organs are losing their function. So the consequences of that loss of function, slow respiration and pupil dilatation. The pupils in the eyes get dilated, and hot and red skin. Because the temperature is more, the skin of the affected person is hot and red skin. And mental dysfunction. Mentally he will be like confused. He cannot look at the place and he cannot say what condition he is in. And sometimes seizures. In severe cases, the seizures takes place. Seizures means the fits. The patient may fall in the fits also. And pulse rate. The pulse rate gets slowed down. The pulse rate also decreases because the patient's condition is deteriorating hour by hour. So these are the clinical manifestations of the heat stroke. Slow respiration, pupil dilatation, hot and red skin, mental dysfunction, confusion and seizures, and pulse rate slow down. Now let us see the management of the heat exhaustion. He found a patient with the heat exhaustion. He collapsed. He fell down. What the first thing you have to do? You'll have to take the patient to a cool environment or cool place and make him to lie down on a surface in a cool atmosphere. Okay, once you place him on a good atmosphere and on a surface, what the first thing you have to do? The first thing, check the vital signs manually, pulse rate, respiration rate, and you come to know he is having high temperature and he lost water and electrolytes. So what we have to do? Replace the fluids and electrolytes. Fluids and electrolytes at least 2 to 2.5 liters. 2 to 2.5 liters fluids will have to give through IV, intravenous therapy. IV will have to give by, how will have to replace? By 0.9% of NS, normal saline. Will have to give IV. By that, some electrolytes may be replaced and patient may come back to the normal. And we also encourage the patient to drink orally also. If the patient is able to drink, we can ask the patient to drink fluids more orally, oral fluids. Even ORS also you can give. What is the ORS? Oral rehydration. Oral rehydration solution. ORS solution. ORS means oral rehydration solutions are available at every PHC and sub-centers. Those are having electrolytes, but without doctor's suggestions we should not give. Why? Because I told you without doctor's suggestion, because this ORS solution is having all the electrolytes, sodium, potassium and chlorides and glucose. Why we should not give without doctor's suggestion means, in case of cardiac patients we cannot give without doctor's suggestion, because in them if we replace ORS, there is a adverse actions, fluid retention or cardiac arrest because of excessive potassium. So to avoid that one, we can replace the ORS solutions with only doctor's suggestion. Now, what is the management of heat cramps? Management of heat cramps. What is happening in heat cramps? Muscle spasms or muscle contractions or carpal spasms. To relieve that one, you can stretch the affected muscle. If in case of hand is affected, you can stretch the hand, and or if in case legs are affected, you can stretch the legs, and encourage the patient to do some stretching exercises. Encourage the patient to do some stretching exercises. By that the cramps may subside. And another thing is, fluids and electrolytes we have to replace, right? When we replace electrolytes, then the muscles may come back to the normal functioning, and we can avoid further extension of the condition to the heat stroke. Now the management of heat stroke. We discussed heat stroke means the increased body temperature more than 104 degree Fahrenheit or hyperpyrexia. So to cool down the body's temperature, what we'll have to do? We should give cold sponge or cold compression. Cold compression we should give with the water temperature of 30 degree Fahrenheit. Why? Why? Because already the patient is exposing to the fan air. So to avoid the sudden or crisis, temperature crisis means the sudden fall down of the temperature. If the body temperature suddenly falls also, it is danger. So to avoid that one, we'll have to give cold compression with a water temperature of 30 degree Fahrenheit, and wet the cloths continuously. Wet the patient's cloth continuously and expose him to the fan air. By that his body temperature comes down. And keep ice packs axillary and at groin, at the armpit and groin region. If necessary, you will have to keep ice packs. You know ice packs, right? You are all freeze are having ice packs. Okay, that ice packs you can keep at the after wrapping in the cloth. You will have to keep in the groin or axillary region to make the temperature to come down normally. And if in case if it is very excessive temperature and patient is in a crisis, patient is like near to die, means like patient is like exhausted very highly, very severely, in that case what we have to do, we may keep the patient in a ice box also, but under a continuous monitoring, of the patient vital signs. So in some cases patient may be kept in the ice box to bring the temperature to the normal range. These are all the definitions of the heat emergencies and the clinical manifestations of the heat emergencies and the management of the heat emergencies. What are the heat emergencies? They are mainly three: heat exhaustion, heat cramps and heat stroke. So some of the clinical manifestations are there depending upon the emergencies, and management measurements will have to take to bring the patient out of the danger.